I would like to welcome all of our participants to this webinar, which is being hosted by the Georgia Academy of Family Physicians. This event is being recorded, and as a result, a link to this webinar will be available on the website, the Georgia Academy of Family Physicians website, and you'll be given that address shortly. You can then share this information with your colleagues. All attendees' phones are muted, and we will hold questions to the end of this session. And the questions and answer period will be used the chat function on your screen. You should be able to find either at the top of your monitor or over to the side the chat function, and you can type in the questions there. And we do this so that the questions can be read and then recorded as part of the process. At this point in time, what I'd like to do is introduce Kathy Durham, who is the Director of Outreach with the Georgia Academy of Family Physicians.
Thank you, Susan, and welcome everyone. I appreciate you joining us today. As Susan said, I'm Kathy Durham, the Director of Outreach at the Georgia Academy of Family Physicians. GAFP has had an ongoing partnership with the Georgia Department of Public Health, and we value the opportunity to share this with you, this exciting new program. Our presenter today is Carol Wilson. She's a former public health nurse who is now working as the project manager for Georgia's Maternal, Infant, and Early Childhood Home Visiting Program. Since retirement from the previous State Department of Human Resources in 2005, she has served as an early childhood consultant with the State Family Connection Partnership and the Governor's Office for Children and Family. In her new role as the Maternal, Infant, and Early Childhood Home Visiting Program, she has the opportunity to assist in the implementation of Great Start Georgia. It's a community-based system of services and supports to expectant parents, children birth to age 5, and their families, and she's going to tell us more about that today. Her work has always focused on the overall well-being of pregnant women, children, and families. Thank you, and Carol, it's all yours.
Thank you very much, Kathy. I'm happy to be with you today, and I want to talk to you about this new initiative in Georgia that we're calling Great Start Georgia. The early years last a lifetime. Over the last 20 years or so that I've been involved in maternal and child health functions in Georgia, we've been working on a vision for the future of how each community can provide a system, a comprehensive system of services for pregnant women and children birth to 5 and their families. And what you see in front of you just now is a diagram that outlines this vision for Georgia. I'm going to go into more detail about the diagram in just a few minutes, but I just wanted to show this to you as the framework from which we are working. You'll see there if you can see at the top right-hand corner, the target population again is all expectant parents, children birth to 5 and their families in a given community. And we're trying this system in 7 different communities. But our vision is for every community in Georgia in the future to have such a system in place so that we can begin providing services and supports to families at least during the prenatal period and in the early years of life. So this is really a vision for how communities will make available natural supports for all expectant families. And families with young children. The idea is that we want to provide a welcome for every child born into the community and provide basic parenting information and resources to all families, link families with more intensive services when those are needed. The system requires a lot of collaboration among service providers. To, number one, help identify families that are in this target population so that they can be screened, and then work together to provide all the services that families might need to provide the nurturing environments that we want children to grow up in. Right now, the initiative is unfolding, like I said, in various stages in communities across Georgia, and we're starting with 7 of those communities. The lead agency for the work in Georgia is the Governor's Office for Children and Families. That office is serving as the convener and leader of the effort, but there are many more partners involved that are providing direction and guidance. They include all of the state agencies that are serving children and families, and the Department of Public Health is one of our major collaborative partners in this effort. But you can see some of the other partners are listed here: Division of Family and Children's Services, Behavioral Health Services, Department of Education, and we also have Georgia Family Connection Partnership as a private agency, and the Birth to 5 Coalition of Voices for Georgia's Children, along with a Healthy Start program, a federally funded Healthy Start program from the Augusta area. These are the partners that make up the members of the leadership team for this effort. Just starting off with a comprehensive system, and what we mean by that is just a broad, flexible array of effective community-based services and supports for a specific population that are organized into a coordinated framework. And the purpose, of course, is for improving specific outcomes. And in this Great Start Georgia system, the outcomes that we're most interested in are maternal and child health, child safety, school readiness, community and family safety, and family economic self-sufficiency. Great Start Georgia considers the full range of factors that determine well-being. So we're looking at health-related concerns, but also the environment in which children and families live. It's based on the premise that all families can benefit from support at times during their lives, especially during pregnancy, at the time of birth, and through the early years. It considers, emphasizes prevention and early intervention services that are community-based and voluntary. Of course, we have to work with families as partners because all of this is voluntary on the part of families. And our goal is to work with families to help determine what their needs are and then make sure they're linked to the services that are available in the community. Back in 2010, there is a program that was authorized at the federal level called the Maternal, Infant, and Early Childhood Home Visiting Program. This made federal dollars available to states to provide evidence-based home visiting. Evidence-based home visiting just means that there has been a great deal of research done to show that specific home visiting programs, and I'll talk more about those in just a few minutes, but specific programs, if they're administered in the same way, can achieve results that dramatically improve pregnancy and birth outcomes, reduce infant mortality and child abuse and neglect, improve school readiness and achievement, and increase family self-sufficiency. So in Georgia, we, of course, wanted to take advantage of the federal dollars so that we can provide additional services to families with intensive needs. And this particular pot of money was designed to serve the most vulnerable families. The funding supports the central intake function of the diagram that we looked at just a few minutes ago, and which is just how families are identified and get into the system, and then implementation of the specific evidence-based home visiting program. 7 counties are receiving this federal funding through the Governor's Office for Children and Families to embed these home visiting programs within their local Great Start Georgia systems. And these are the 7 counties that, of course, you guys know about: Clark, Crisp, DeKalb, Glenn, Houston, Muskogee, and Whitfield. I won't go into the details of how those counties were selected, except to say that there was a needs assessment that was done by the Department of Public Health to determine which counties fell into the highest risk groups. And out of that process, these 7 counties were identified. Again, I'm coming back to the diagram because I want to talk just a minute about the functions that are a part of this diagram. If you see at the very top in box 1, and I know this is probably hard for many of you to see, so we're going to have this available as a handout after the webinar so that you'll be able to print it and look at it in more detail. But basically, the system starts with a community outreach effort, which is just the process of asking service providers and anyone else in the community that might have an opportunity to interact with pregnant women and children birth to 5 and their families to help us identify those families, and with the parents' permission, provide a screening process, which is a part of the box number 2, which is the central intake function. The screening is just a process to try to identify the needs that families have. And then in the box 3, the boxes across the bottom list the community services and programs that families may be referred to. One of the things that I wanted to point out for this audience is that under the maternal and child health area, the green box, the second green box there from your left, primary health care is listed as one of the services. We want to make sure that families are linked with a primary health care provider. That's one of the main things that's done to make sure if they're not already connected with a primary health care provider, then it becomes the job of the staff working within this system to make that linkage available to them, to let them know where in their community they can go for primary health care and try to ensure that not only are they given a referral, but they're actually linked with that primary care provider. So there is a feedback loop in the system that would allow the system to know which families are actually being served by primary health care providers or any of these other providers that are listed. So again, the system functions, just to list those out, are the community outreach function for identification and referral, central intake within the community for screening and data management. Once the screening has been completed, the results of that screening process are entered into a data management system, which is going to be managed by the Department of Public Health. The next function is linkage to community services, and then lastly, coordination of care by and among the providers that are providing services to the family, and especially for families with higher needs. The central intake function alone does several things. It receives the referral, contacts the families to see what their desire is about being a part of this system. The comprehensive screening is completed. The information from that screen is entered into the data system, and then families are linked with services. This central intake function has already started in the 7 communities that we talked about, and each community is doing that in different ways. However, in October of this year, the Department of Public Health is going to be coordinating that function. So after October 1st, referrals on families can be made by contacting the local health department in one of the 7 counties, accessing the Great Start Georgia website, which is not up and running yet, but will be by October 1st. On that website, there will be a portal. Just by a click of your mouse, you can get to a portal that will allow you to provide demographic information about the family, just name and address and contact information, so that families can be referred into the system. You may do that through your own offices, or anyone else in the community will have the ability to do that, as well as families themselves if they would like to self-refer. The other way that families can get into the system after October 1st is by accessing a toll-free number that will take the caller to a state resource center or call center that will be, again, run by the Department of Public Health. A vendor is being selected for that service now, and by October 1st, that will be up and running in Georgia, and you will hear more about that between now and October 1st. Going back to the community services and just talking a little bit more about that, the evidence-based home visiting programs are just one of the community services listed on the diagram. Not all families, of course, will qualify for or need home visiting services, but we want them to benefit from the other services and supports in the community. And across the bottom of the diagram in the boxes that I was pointing out earlier, like under maternal and child health, those are the federal outcome areas of interest. So that with these federal dollars, we're going to be providing services that hopefully will improve outcomes in each of those different areas in Georgia. And as you all know, I'm sure, Georgia falls at the bottom of the list in many areas of child and family well-being, and we have many areas where we need to improve outcomes. While home visiting is very important and something that is a centerpiece of the system, we know that not all families need long-term intensive home visitation, which all of these evidence-based programs are. But as I said, there are many other services in the communities that families can access. So the goal is to identify and screen families on a voluntary basis so that needs and services can be addressed, either through home visiting or through one of the other community services. The evidence-based home visiting models that have been selected for Georgia are the Early Head Start home-based option, meaning there is Early Head Start that is clinic-based, but that model has not been approved at the federal level for improving these outcomes. This Early Head Start model is the home-based option. Then there is Healthy Families Georgia, based on the Healthy Families America model. Then there's Parents as Teachers, which there are many different programs in Georgia already for Parents as Teachers and Healthy Families Georgia. So I'm sure you've heard about each of those. And then a new one that has just been added with these federal dollars is the Nurse Family Partnership, which is a model that uses nurses for home visits and provides services for first-time moms, and they have to be identified during the pregnancy to be a part of that program, and then they are followed up to 2 years of age. And just so you know, some of these counties have more than one program. So this is just a list of the home visiting models that are being implemented in each of the 7 counties. You can see that in some counties there's just one model, like in Crisp there's just one, which is Healthy Families. But in Muskogee County there are actually 3 models being implemented: Healthy Families, Parents as Teachers, and Nurse-Family Partnership. These models do not serve the same population, so we're not duplicating services here at all. Going back to the central intake function that I mentioned that the Department of Public Health will be coordinating as of October 1st, the funding for that central intake system is with another grant that we received from the federal office, a competitive grant. So not all states received this money, but Georgia was fortunate enough to receive this competitive grant starting October 1 last year. And there are two components to this grant. One is the central intake function that Public Health will be managing through their Maternal and Child Health Office and specifically through Children First. And the second part of that is a family engagement and retention research project that is being developed and coordinated by the Center for Family Research at the University of Georgia. As I mentioned, Public Health will not be they will not have responsibility for the coordinating function until October 1st, which is fast approaching. But until then, we have central intake coordinators in each of these counties that can receive referrals on families. If you should have, through your offices, families that you would like to refer to the system, these are the contact people. And again, we will provide this information to you in a handout so that you'll be able to download that and print it and have it available at your office. I've listed for you the name of the person, their telephone number, and their email address. Strengths of the Great Start Georgia system: it provides a framework for supporting families with young children in their communities to improve their well-being. It requires a shared commitment from many private and public entities that serve children birth to age 5 and their families. And another great strength is the natural partnership with the Department of Public Health for the central intake function. One part of that central intake function that I didn't mention is that Public Health, of course, has access to all the birth certificates in Georgia, and through an electronic screening process, we will be able to make sure that we are able to identify all families that have a newborn so that we can try to make contact with them to make sure that they're receiving the services that they need and desire for their families. The strengths include increased capacity to assure the opportunities for families to improve their outcomes. We can expand and improve on our existing home visiting services in the state and embed those services in an early childhood system. We can engage and retain families in needed services. We hope that this research project around family engagement and retention will provide more information about what are the steps needed to truly engage families and have them remain in systems long enough so that we can see real outcomes. Also, this Great Start Georgia provides an opportunity to expand existing home visiting program models and infrastructure. So people may ask, so what is Great Start Georgia? The simple answer for us is that it is all of us working together to make Georgia a place where children can have a great start. We know that the early years are very important. All the brain research tells us how important the early years are in the long-term outcomes. And we invite you to be a part of this effort and working with the Great Start Georgia leadership team to support this effort. Here is my contact information, and I'd be happy to take questions.
Thank you so much, Carol, for that informative presentation. At this point in time, there's some additional information on your screen which indicates some specific details if you are presenting this in the context of a lunch and learn. Kathy, do you want to talk about that just for a moment?
Thank you. We are happy to reimburse you for lunch up to $75. I just need a copy of that receipt and a copy of a sign-in sheet for everyone who's attended the webinar. You may fax that to me at 404-321-7450. Again, fax that information to Kathy Durham at 404-321-7450. Friday will be the last date that I can receive that information. So as of close of business on June 29th, this offer will then be void. So I hope you get that to me, and we'll turn that reimbursement around quickly.
Thank you, Kathy. As we said earlier, this webinar has been recorded, and the link to the webinar will be available through the Georgia Academy of Family Physicians website, which is www.gafp.org, and you should be able to find a link to that on that website. At this point in time, we will take questions, again, using the chat function of this webinar. If you wish to ask a question at this point in time, we would be more than happy to have Carol or Kathy respond to those. Are there any questions? I have not seen any show up, so we thank you so much for your time and interest in this important topic, and please share this information with your colleagues. Thank you so much. This ends the webinar.